Welcome to Everything Cancer, the empowering podcast for the cancer journey. I am Jill, your host, a longtime certified oncology nurse, cancer support group facilitator, and person striving to get the word out there about the proven power of effective self-advocacy on the cancer journey. This podcast is designed for those on the journey, those who love them, and also for providers to offer them a fresh and enlightening perspective. We have an engaging and warm spectrum of guests, from survivors to providers, both very inspiring, and cancer support organizations that offer amazing services, and to hear about managing symptoms and gaining a higher quality of life. We've got it all. We'll be discussing rekindling the intimacy after cancer changed your world. We'll break down practicing self-advocacy into easy-to-do, bite-sized pieces. We'll talk about everything cancer. Hello. The Everything Cancer podcast and the information presented on it are not intended to be used in place of medical advice. Please consult with your healthcare team regarding your healthcare concerns. The Everything Cancer podcast staff will not be answering individual healthcare questions. We greatly appreciate you being here, and we hope you enjoy this up-and-coming episode. Thank you. Hello, everybody. Welcome to Everything Cancer, the extra-large suitcase of the cancer journey. And we have, I like Michelle's little laugh there. We have an amazing person with us, Michelle Kirschner. I'll let her introduce herself. Take it away.
Well, I'm so excited to be here. So, and any opportunity to talk about survivorship, I'm on it. So a little bit about myself. I'm actually a nurse practitioner, and my journey, I was a nurse, an ICU nurse for 10 years, and then I became a nurse practitioner. And I actually worked in cardiology and pulmonology before I discovered oncology. So I came into survivorship kind of through this internal medicine background. And so really I've worked with individuals and kind of understanding chronic illness for quite a while. And I became, at the University of Cincinnati, they were hiring for a full-time nurse practitioner to lead their survivorship clinic. And so I joined and I worked in that position for approximately 8 years. And as
Wow.
I was doing, that, I was had the privilege to be able to become the director of program development. So not only did I have the opportunity of seeing my patients and learning and sharing on their journeys, but really then to build out the services that they needed. And as I did that, each area, I actually became an expert in that. So mental health needs, physical needs with cancer rehab, sexual health needs, cognitive needs. And so I feel I bring together this wealth of knowledge, but also the idea of how do we build programs? How are we serving our survivors? Are we providing them good supportive care? And, I felt like we were building something great at our hospital, but not even all the patients at my institution got to my program. So I think there's going to be a lot that we can talk about today.
Yeah, absolutely. Absolutely. So tell us about the Cancer Survivor Provider Network.
Okay. So I actually, I'm the director of program development, and actually that organization was developed, or it was created in 2013 by a nurse practitioner, Leslie Herron, who's our founding director. And it really just started with individuals who are providing care, and they said, there's not much information about this specialty of how do we help individuals who have cancer. And so they just started having monthly get-togethers in Washington State. And then over time, it slowly grew. And then I joined on about 2021. At that time, Lisa Rudvik, she's the actual director right now, and we re-envisioned the whole organization. And we said we actually launched our online community, and we opened it up. We really said anyone who provides care for oncology patients and their care partners, we need to come together to share information, to support each other, and to change, to promote change on the
Mm-hmm.
ground. And so this community, it doesn't cost anything to join. And we have an amazing library of educational hours. We have
Mm-hmm.
meetings where people can get together and share information, and we have community-led projects where people will say, like, we need to create something, and we work together to do it. And I think that we are hoping to change, uh, kind of change and improve what's going on in our cancer.
Our cancer centers work hard in behalf of our patients and they provide standard of care and beyond. But there is a lot of room to grow in this area. Can you define for us survivorship?
I'm yes. And this is something that I think a lot of people are used to thinking of survivorship as kind of a program that's there for them after
Mm-hmm.
treatment is ended. But actually, the way it started, the concept of survivorship, it was started by a physician, Dr. Mullen. He actually was a primary care physician who had cancer, and he said that you are treating cancer itself, but you are not treating the whole person, and that there is so much more that needs to be done. And he elevated this, and that started the National Coalition of Cancer Survivorship.
I love
His
that place.
Yes. So
Mm-hmm.
his model, which is really the model for survivorship, starts at day of diagnosis. And so there's phases of survivorship. So there's an acute phase of survivorship. That phase is when individuals are obtaining treatment. Those things are really important to understand. What are the needs of when you're first diagnosed? Right. So that's getting information, dealing with anxiety. Sometimes it's dealing with grief because you're kind of
Mm-hmm.
giving up the vision of what your life was. It might be dealing with some pre-existing physical issues that are going to be worsened through your cancer treatment. So again, that acute phase is dealing with all the issues that need to get you through treatment, but understanding the support you need, right?
Mm-hmm.
And for the care partner. Then you have a phase that's called extended survivorship, and that's for those individuals who are going through curative treatment. They finish treatment and now they're under surveillance. So they have to come back for all those scans. And it's actually it's a important time because individuals are transitioning from their
Mm-hmm.
care teams who have been with them. It's like we're in it together, and suddenly they're like, "Yep, see you in 6 months. Go into the world and do your stuff." And you're like, "Oh my gosh, what is going on?" And oftentimes, a lot of the issues that come along, you don't individuals will not realize them until they get back into their normal life. And they'll
Mm-hmm.
say, like, wow, my fatigue is really causing issues, or my
Mm-hmm.
cognitive impairment is really causing problems at work. And so again, so that's another phase of survivorship. And a lot of times the survivorship programs that you see sometimes are there created to help around that time. And
Mm-hmm.
then and there's a unique needs during that phase. For example, fear of recurrence. Every time there's a
Mm-hmm.
scan.
Yeah.
Yeah, and then the third stage is more of like an prolonged stage of survivorship after you're done with your scans, 5 years or whatever it is for you, and you realize, oh my gosh, like I am actually going to live beyond my cancer, and what is it like to do that? And some people will say like they'll use this phrase like the new you and things like that, and a lot of people don't even like that. They don't want, it's just a matter of figuring out what do I bring from my experience and how do I grow
Mm-hmm.
from it.
Mm-hmm.
But there's a whole, we have that's kind of the standard journey. But actually, we have many people now who live with cancer,
Yeah.
right?
Yeah.
Who live with cancer or who will be on treatment or for a
Mm-hmm.
long time, even though they have no active disease. And so there's other models of individuals. There's individuals with metastatic cancer who will live many years. And
Right.
so we in survivorship have been saying everyone is included in survivorship. We're all survivors from day of diagnosis. And so one of the issues is that some hospitals, if they're using more traditional definitions and they're using that like end of treatment, in order to like start giving you supportive care, then we're excluding a lot of people.
Right. Right. What do you mean by supportive care?
Yeah, support. So I always, when I meet with my patients, I just start off and saying, okay, you have your oncology team. You have either you can have a surgeon, a medical oncologist, a radiation oncologist, and they are looking at you through the lens of your cancer. They are there to pinpoint that cancer and kill it. That's their job. And
Right.
my job is to deal with all the other things that come along with that. And that includes the psychosocial, again, all of
Mm-hmm.
those issues, but it's also the side effects of treatment.
Mm-hmm.
And and especially the ones that are going to extend beyond treatment. Oftentimes, the active treatment teams will deal with the side effects that have to do with nausea and other types of things, but we want to prevent things that are going to, move beyond that.
Mm-hmm.
So, physical impairment that could happen because of surgery or radiation. Um, I said cognitive, mental health issues, trauma, so sexual health, it's
Yeah.
so encompassing. It's also wellness, because a
Yes.
component
Yes.
is that we want to prevent recurrence, and a lot of individuals are motivated. Okay, I've just gone through this experience, I never want to do this again. And it's about controlling the controllables. What can I do to help myself? So
Right.
yeah.
Right. So, how can you take better care of yourself? How can you practice wellness to keep that risk of recurrence down? And it's a specter that I understand from the support groups I facilitate. It's there. It doesn't leave. And especially when you go back for your scans, you really think about what is the scan, or what is my tumor marker going to show? What is the scan going to show? But a lot of people also learn to just kind of coexist with that and still engage and kind of put the worry behind them until the next scan. But that wellness piece is so huge, not just for prevention of decreasing the risk of recurrence, but also for enjoying life and being
Mhm.
engaged again with your family, with your job, with your kids, or whatever you want to do to enjoy yourself and feel fulfilled. Um, so, what do you feel are a lot of the prevalent issues, say in the acute phase, and then in the extended phase?
Yeah. So I would say, and I do want to say also, kind of in this conversation, is that in the acute phase, there's a lot of things, even lifestyle changes, that can help improve
Hmm.
outcomes from treatment.
Great.
And
Let's go over
actually,
those.
it's like,
Great.
so when we talk about the acute phase, there's a few things. One
Hmm.
is being proactive. Okay, so again, we're starting to create rehab programs called pre-hab. We
Hmm.
don't wait for problems to start. So part of the active treatment is getting individuals into prehab programs if possible, so that they can start getting evaluated for any like
Hmm.
existing issues, things that they need to be working on, and so that their support team will be with them right then and there throughout treatment. There's
Hmm.
also thinking of things that you can be, again, proactive on in preventing long-term effects. So one example is during chemotherapy, there are a lot of patients who can do cold therapy for their hands and their feet to
Hmm.
prevent neuropathy. And
Hmm.
so it's really important that there's someone there who's teaching the patients about these opportunities, because if you don't
Right.
do it, you can't go back and do it.
Right.
So any
Yeah.
of these things that we can prevent something from happening, we want to do.
Hmm.
And then a lot of the things that are occurring are really around psychosocial, looking at that new diagnosis, and understanding emotionally, how do I process this, and building resources for yourself to help you through
Hmm.
the journey. And I would say the number one thing in that area is actually your care partner, or the people who are going to be in the journey with you, really nurturing that relationship, and really having very open conversations about the type of support you want, even like when you're not feeling well. how do I like to be cared for?
Mm-hmm.
What kind of information do I want when I go to
Mm-hmm.
appointments?
Mm-hmm.
I like to hear every little detail, or the big picture person. Do not tell me the details. Just tell me what I need to do. Those
Mm-hmm.
things really need to be understood and negotiated so everybody's in line and working together efficiently to get through active treatment. So those are mhm, active treatment.
Absolutely. And it's dynamic because you don't know what you don't know when you enter active treatment. So you may have said just the big picture, but once you get into active treatment, suddenly you're like, I want all the details. Or your partner wants all the details to help support you better because they're blown away by everything that's happening. So understand that keeping the communication open and understanding it's going to be fluid, I think is really important. As long as you're there supporting each other, listening well is huge, both the the person being treated and their care partner. And just and if you need to go into therapy, go ahead along with it. And there's a lot of resources for therapy. If you can't handle the copays right now, cancercare.org has clinic oncology social workers. I know I'm preaching to the choir here.
Mhm.
Many local support organizations will offer up to say 6 counseling sessions with a clinically licensed social worker to help with fill in the gap where counseling may be helpful. This is like such great information. So you were talking about prehab. What are you seeing happening with people that enter prehab but then need rehab after, say, with pelvic floor physical therapy or oncology rehab for strengthening after weakness from surgery or peripheral neuropathy, and they only have so many PT and OT rehab visits a year? What kind of resources and what kind of plans of care can be set up to work within those areas?
Yeah, so there's a few things. One is that, in even within rehab, different services are aligned differently. So even if you're given a certain amount of days for this type of care, sometimes you're given additional days for specific other
Mm-hmm.
um, things. But prehab is becoming more of it's becoming known. So the good thing about what's happening now with insurance companies is they're starting to understand and hear about prehab. And so the
Mm-hmm.
way it's being billed is oftentimes not taking the certain amount of days that you
Oh,
have.
good.
But this comes back to being your own advocate, because
Yes.
quite honestly, every insurance company is different. And so these are all really good questions. So when you're being referred to these programs, you do need to ask the questions for your specific case and say, I just want to understand, how will this could this limit me from seeing other individuals after treatment? So
Mm-hmm.
yeah, so I think that's it.
Right. And then also there's you can be referred once you see a therapist and you reach a certain level, you can start exercising or instructions they have you follow. And those things really do take your investment as a person that's been affected by cancer to do what you need to do at home in between seeing a therapist for them to really work. But also, they'll help with your energy. They'll help with your sense of control over your situation. They'll help with your sense of wellness. Plus, just the stress escape you get from physical activity is huge. And I can say, in where I am right now in the acute care area, being strong as you can be before a surgical oncology surgery will
Mhm.
make the hugest difference for you recovering more quickly and having better wellness after you recover and being more resilient after surgery. I cannot stress enough how important, and not everybody has the ability to do that. It depends on what is happening, their particular framework when they're entering surgery. But as much as you can, even if you can do chair yoga or something prior to surgery, that will make such a big difference.
Yeah.
That's good to hear. And self-advocacy is so huge with this. Absolutely. And I hope that people here that are listening are saying, okay, prehab, if they're facing a surgery or something, because a lot of times the treatment is in phases where you'll have chemotherapy and radiation prior, and then surgery, and then more treatment after, but staying as strong as you can and getting as strong as you can. So the extended phase, What do you find are a lot of the issues there, and what do you find is really becoming helpful or is helpful for people?
So I think from the mental health standpoint, is this idea of like that transitioning from your cancer team to understanding that you need to develop kind of a
Mm-hmm.
new team. But also, what's really unique that I've heard expressed a lot is that when individuals are done with treatment, that their friends and family that are around them, their cheerleaders, suddenly kind of feel like, well, they're done with treatment. They don't really need
Yeah.
that support, and so that then it's almost like that loss of personal support. So a lot of it is just communication, because
Mm-hmm.
I always say people, after treatment, they look a lot better, but they feel really terrible inside a lot of
Mm-hmm.
times with the fatigue and cognitive
Mm-hmm.
impairment that usually can extend beyond. And so, and that can lead, all those things can lead to the depression and just
Mm-hmm.
feeling down and defeated. So I think, again, I said, like, create your plan, create your, uh, don't don't let things happen by chance. Say like, okay, I know I'm at higher risk for depression. I know that people might not understand what's going on, so I'm going to develop my self-care plan, and I'm going to exercise. I'm going to work on better nutrition, or I'm going to work on something else. I'm going to work on
Mm-hmm.
relationships and with being with people and letting them know when I see them, kind of like what kind of support I need and what I'm going through. So
Mm-hmm.
develop that mindful, that actual plan of care, and then really be make sure you point out the things that are really barriers, and make sure you have a plan. So when you do see your care team, which you're not going to see them as often, right? But
Mm-hmm.
make sure write up exactly the areas that you're having issues, so that you can be very strategic during the visit. These are the things that I'm having problems with.
Mm-hmm.
And the most important is, as you're leaving your active treatment team, is there a survivorship program? Is there a program specifically created to help me during this transition? If so, seek it out. And I'm just going to tell you, it oftentimes it will be there, but doctors forget to mention it. Care teams forget to tell you about it, and individuals are very surprised. Are you telling me this was here and no one sent me? So you might have something that's very helpful either in your cancer center or in the community. Cancer
Mm-hmm.
support communities are marvelous places, and they have a lot of programming for individuals post treatment.
Yes, the support groups are huge. That shared experience is huge in terms of the mental health part, but also just hearing about other things that other people are using in the support groups that are helping them,
Hmm.
say with peripheral
Yeah.
neuropathy or chronic diarrhea or something like that. Anything along those lines. Just the shared experience piece, because a lot of the local support organizations and national have programs that will help you practice wellness, such as meditation and yoga and things like that, that you can participate with in person or virtually, depending on how it's set up. But there's a ton of options out there. And you may actually find out about a survivorship program if your particular cancer institute didn't have one that's with another one, that you might be able to gain entry to. But
Yeah, and we, in Cincinnati, at the University of Cincinnati,
mhm,
we had individuals come from other hospitals who didn't have well-developed programs. So I think most survivorship programs will welcome individuals from
great.
outside of their institution.
That's so good to hear. So you brought up a really good point of writing down your symptoms and also your barriers. And that's a huge part of self-advocacy, is documenting what your symptoms are, so that when you're in the provider's office talking with them, you have real data right in front of you. You're not trying to recall, especially if you're dealing with some of the chemo brain cognitive issues, um, and they can act on it when it's well documented, when it's well journaled. Journaling is another way to put it. Also, what is keeping you from doing things? What are your barriers you're running into? Are there if you are trying to go, say, to physical therapy and there's copay issues and you can't afford it, they may be able to refer you to resources or a place that can help you with that, have some ideas. The navigator in that office may be able to, there's the social worker, there's a lot of different things. You can also take those barriers with you to your support organizations too, and see if they can help you with that. But having it written down makes it so much easier. And we're not here to plug my book, but I will say that my book on Amazon, Cancer Journey Guide and Journals, Empowerment in Diagnosis, Treatment, and Beyond, is set up just for that, to document all of your symptoms well, to document when they're happening, how often they're occurring, what type they are, and then your barriers and also your next steps to resolving things, and helps keep it all organized and together. But anyway, this is such valuable information.
Yeah.
What are your thoughts in terms of accessing resources? You talked about a survivorship program. What else, Michelle?
Yeah. So, there's I'm always amazed at how many resources there are on in the world. And so actually one place, it's called Nancy's List, and it's online.
Yes.
And it actually has probably the most extensive list of resources that I have seen. So that's one kind of nice place to go.
Mm-hmm.
Large organizations like the American Cancer Society have helplines so that you can oftentimes call them and they can, understand and
Mm-hmm.
connect you. And then the National Coalition of Cancer Survivorship. But you always want to start. There's kind of a layering. So first, you want to know
Mm-hmm.
the resources in your hospital
Mm-hmm.
it's, itself. Then the resources within your city that are local that you can attend in person, because we know that
Mm-hmm.
there's a lot of benefit with being with others. And then those national resources. So there might be something that's very specific topic that you might not be able to find in your local area, or you
Mm-hmm.
want to be with a certain population of survivors. You want survivors that are just like yourself. So that those are groups that you might need to find nationally. And so yeah, so I would say they're definitely out there, and it just takes a matter of sometimes going online, but start with some of those larger organizations. They'll usually have lists of other
Mm-hmm.
organizations. And one of the I say is create, if you have your support team, which I call it like your crew, like you're the
Mm-hmm.
pilot, your co-pilot is your cancer team, and your oncologist. They're kind of helping you through the journey, and then you have your crew, and you have the people, and so each crew member, who can do what. So if you have a crew member who's really good at finding information, then work with that person.
Mm-hmm.
Find the person that can help you. That's part of advocacy. Is not You don't even have to do everything yourself. The
Right.
first
Right.
step is finding the right person to help you do everything else. So
Right.
yeah.
It can be daunting handling it on your own. You're already overwhelmed by everything. So that's a great strategy. I love that. I wrote it down while we were
Okay.
talking. So as I'm turning my head, I'm taking quick notes. Um, the other, and Nancy's List is great. I've really grown to enjoy everything that's on it. So tell us about the Cancer Survivor Provider Network.
Hmm. So that organization is, it's not for survivors,
Right.
because there are organizations out there for survivors. So it is for anyone who's providing care. So it's
Yes.
for oncologists. Primary
Mm-hmm.
care physicians can join,
Mm-hmm.
nurse practitioners, PAs, nurses, nurse navigators,
Mm-hmm.
physical therapists, occupational therapists, speech therapists, social workers, psychologists, and then there's actually organizational CEOs and leaders of it could be survivors who've built
Mm-hmm.
great things, who are doing great things. They come together in this kind of community to work together, again, to
Mm-hmm.
learn together, to work together, to support each other, and to support real change on the ground. So but what I would say is, if you're with your oncologist or you're with your team, and there you see that are individuals who are really kind of responsible for supportive care, recommend that they join, because
Yes.
they're going to learn a lot and they'll do their
Yes.
job better. Hmm.
It's an amazing place. It really is an amazing forum, and just knowing for the people that are listening that are not providers that it exists, and suggesting to your provider they join, because they may not know about it, and then providers that are listening, look it up, because it you'll find all kinds of great rabbit holes while you're there, as far as people and articles and resources. And it really, if you have a question, it helps to look up literature. It's great, but this is so much more tangible, and you can back everything up with evidence when you reverse engineer it and find your evidence, or a combination of the two. But it is tangible, it's real, and you can talk about the real experiences these providers are having with their survivors. And I love it. It's been great, and I'm really looking forward to diving in more. And thank you for inviting me
Yeah.
into it, Michelle.
Yeah, it's
It's
my
great.
pleasure.
It's Thank you. Thank you. So what is your vision for cancer for the cancer survivor journey?
So, you're saying for like what do I envision for all cancer survivors or
Yes. Yes.
so we actually have it. It's written down. Catherine Alfano created
Okay,
it.
great.
It's called
Okay.
the team model, capital TEAM. And I love, and I just met with Catherine this week, and I just told Catherine, like we don't all have to like try to think it up. It's written down. We just need people to actually do it. And what does this model say? It says that when you go to a cancer center, you have your oncology team that creates your treatment plan.
Mm-hmm.
At the same time, you have a specifically trained up group of providers that are your supportive care team. We could
Mm-hmm.
call it survivorship. A lot of people, again, think of survivorship after care. You could call it survivorship. We're looking for a name, so if anyone, but it's your supportive care team that is driven by a provider. It is a specialized provider, just like me, who, like I said, I am knowledgeable in all these areas.
Mm-hmm.
And that provider is called like an onco-generalist. It's a person who
Mm-hmm.
knows about all the elements of supportive care, and they have in their team the social worker, the dietitian, the physical therapist, the exercise specialist, the sexual health specialist. And so they know all the individuals, so that when they
Mm-hmm.
see you, they're directing you to a team member that they work with and know about. And
Mm-hmm.
then they also can direct you to local services, national services. They're experts in supportive
Mm-hmm.
care. And I think that oncologists and oncology teams, they really want, their goal is to help, and but they spend so much time just learning about how to treat cancer.
Yes.
They
Yes.
don't have time to become experts in supportive care.
Right.
And that's why we're recommending having a team that's there, that they are continuously learning and striving to actualize high quality supportive care.
That's awesome. I love that. And what does team stand for right now?
I don't, I really don't know, but it's all capital.
Okay.
So yeah, it's really, there's the nice thing is that there's a paper about it, that like if
Yeah.
any provider out there wants to know what it is, you just look up Catherine Alfano Team Medicine
It's a great organization.
for cancer,
NCCS.
the National Coalition of Cancer
Thank you.
Survivorship.
Coalition. I
Yeah,
always
cancer.
forget the
Mhm.
coalition, and I should
Right,
remember that. I'm going to
right.
tattoo that on my wrist now.
So when we talk about the coalition, that coalition is really focused on advocacy. And so
Yes.
we talked about being advocates for yourself.
Yes.
But one, really, survivors need an advocate within the healthcare systems and within the U.S. Legislation, and creating policy that will
Mm-hmm.
promote good care, because a lot of the things that happen really are driven by the policy. The U.S. government is the number one
Mm-hmm.
funder of medical care through Medicaid and Medicare. Um, so, and also individuals, once they go through their cancer journey, or people who are living with cancer,
Mm-hmm.
often are very motivated. They want to have a way to express this advocacy, and so
Mm-hmm.
it's a wonderful place to come together, to be with other survivors who really feel very strongly. And so if you want to do something about, you want to accomplish something, change something, the NCCS is a great place to start and to look at. And they And they also have great educational programs
Yes.
that the
Yes.
webinars that
Yeah.
really are for survivors. So they're usually explaining content in a way that you can explain it, not too medical, but really what
Right.
you need to know.
I was going to say, if you're too overwhelmed right now to
Mhm.
be an agent for change and you're
Uh-huh.
just taking care of yourself or you're taking care of your partner and that's what you're concentrating on, which is great. NCCS, you can look it up that way
Mhm.
online, it is chock full of really good information that is sometimes difficult to find from other sites. And it really talks about good self advocacy, understanding your plan of care, financial advocacy for yourself. It's a yearly survey that they do.
Yes.
It's amazing when it looks at how survivorship is shifting for people, and that's continually shifting as cancer care is shifting.
Yeah, I was going to say that information is also very powerful. You know,
Yes.
for in cancer centers, improvement and change is really driven by data and
Hmm.
knowing the experiences of cancer survivors. And last year they did a special look at cancer caregivers. So that information is actually really useful for individuals, but useful for organizations. And so
Hmm.
if you ever, when they're doing the survey, if you can participate, that's also really great. So usually they'll list it on their website when each year's survey is open. So yeah.
Someone who is afraid
Mhm.
of approaching their oncologist, which a lot of people are, what are some guidelines or tips that you can offer to help people feel more comfortable saying, hey, I really have this issue going on. It's making it hard for me to go to work every day, or it's making it hard for me to be with my kids every day.
Yeah. So I think there's a few things. One is, and again, is being knowledgeable about the topic, and showing your oncology team that
Hmm.
like you actually understand like this is an important thing to deal with,
Hmm.
and again, there's so much information online, even through NCCS about a lot of these
Hmm.
side effects from treatment, but really talking about understanding that, sexual health issues is actually extremely common in cancer
Hmm.
patients. Almost 60% of patients have sexual health issues, and that
Hmm.
sexual health issues actually, we know, don't resolve on their own. They generally get
Right.
worse without treatment. So if you really phrase it in a knowledgeable way, saying like, I know this is a common problem, and I'm aware that this will not get better unless I have treatment for it, then that really will, kind of put the onus on your team to really come up with the solution. So that is one thing. I also, again, if you come to the visits very um, pinpoint in the information you're giving them, so that you really have so that they have the information to work with. So like when you were talking about fatigue, actually rating fatigue on a 0 to 10 scale, 10 being the worst. So if you could say my fatigue is an 8, and my fatigue is actually an 8 at like 11 o'clock in the morning, and
Right.
so I have to take 2 naps a day, and I'm
Hmm.
supposed to work, and I come home from work and I go to sleep at 7 o'clock at night every night, and I can't do anything. If you really show them,
Hmm.
really make them understand what is happening to you at home, what is really
Hmm.
happening, because you have this one time with them, but they don't know. You need them to understand what does it look like your life outside of those
Hmm.
15 minutes you have with them. So, and
Right.
that's where journaling is good again. Write it
Yes.
up. If
Yes.
you can make them understand your lived experience and then
Yeah.
say, this is what I'm experiencing. I need help. I think that humanizes things. It's not a
Yes.
demand. It's saying, please feel what I'm feeling. Please
Right.
understand.
Right. Exactly. And I love that word humanizes because they can relate to what you're saying when you're
Mhm.
talking about it. And journaling is such an important step in this because it gives you confidence when you walk into the provider office because you know what you're talking about. You can talk about how often it's happening, what it's like, how it's interfering with things, and it makes your case for you. And if that doesn't work, go to somebody else in the practice and
Yes.
your navigator or the PA that works with the oncologist
Mhm.
and say, this is what's happening. And I feel like they're not listening. You're going to find an advocate.
Right. And
Yeah.
the other thing I'm going to say about journaling, which is really important, is because you want to understand how things change over time.
Yes.
You're never
Hmm.
static. And so if you have
Right.
a journal, if you've written this down, then you can go back and if you're like, "Oh, when did this start?" or like, "Has this been getting better or worse?" You have this information at your fingertips. So, sometimes when you talk about journaling, people are just thinking about like every night write something down before you
Hmm.
go to sleep, write things down. This is more journaling for a purpose, really be helpful in your journey. So I'm excited to read your book. Okay.
So something you kept touching upon that I think people feel is nebulous, but it actually really does happen and it interferes day to day is cognitive changes, or what we call chemo brain. Can you talk a little bit about that, Michelle? I'll have you back for that.
Yeah, but so it's one of my areas of expertise because I created a cancer cognitive clinic with a neurologist
Oh
here in
gosh,
Cincinnati,
wow. Yeah.
and I worked in the clinic, and and it was so interesting because one of the things I learned about cognition is that um, it's so internal. Nobody can see the struggle that
Right.
that you're feeling. And so, and really, first of all, most oncologists and oncology teams know nothing about cognitive
Hmm.
related cancer related cognitive impairment, CRCI. And in fact, many patients that I've seen from all different places have received incorrect information. So it is really important to find an actual program that deals with cognitive
Hmm.
impairment. A lot of times neuropsychologists who do testing. One of the and I, again, I'm not going to go into all the details, but I want to highlight that how isolating it is
Hmm.
for people who have these symptoms, because again, um, individuals who are surrounding you might not understand how to support you. And I'll give you an example. Sometimes you'll see that individuals with CRCI might say the wrong word or they might forget something. And so the individuals around those people might get frustrated, like, I told
Hmm.
you that already, right? And because they don't understand, how what is CRCI, they don't understand even if you tell somebody something, you shouldn't have the expectation they'll remember it. And so
Hmm.
I almost want to create a course for the caregivers and the friends of people with CRCI, because um, they supporting someone is probably actually helps improve the symptoms, because when you have cognitive impairment, if you become anxious or distressed, it worsens the symptoms. And
Hmm.
so by having support, it actually is a way to treat your cognitive impairment.
Hmm.
So I'll give you like this very quick primer about what CRCI is, just very simply. But when you look, a lot of people think like they are getting dementia or they're getting
Hmm.
Alzheimer's. They can't remember things. That system is a whole different system in the brain. The system that's impacted with cancer treatment, and cancer itself can cause cognitive impairment. It's
Hmm.
not just chemotherapy.
Right.
Many and
Or
many other
radiation. Right.
and many of the drugs, the hormonal blockade, can cause these symptoms. These symptoms are happening in the executive networks in our brain. Executive networks are the networks that we use every day to get things done. So, we need to be able to take information, put them in our brain, work with information, and then things that we want to keep, we'll put them in our long-term memory. When we're when we try to receive information, to put anything in our brain, the first step is you have to have attention. That means
Hmm.
that you need to be able to focus on a piece of information. Attention is one of the areas that's impacted with CRCI. And so
Hmm.
a lot of people who will say, I can't remember things. I have a really bad
Hmm.
memory. It's not that. It's not that you're trying to remember. It never even made it in your brain. And so there's things that you can do even to help yourself remember things, by focusing on it. And there's different tips and tricks. So there's support. A lot of people think like, oh, this is how it is, I can't do anything. There's things you can do to improve your memory and
Hmm.
help you give these trips tick these tricks, my
Yeah.
my cognitive. And also, it's important to do testing, because you don't really understand the type of impairment and the level until you do true testing. So you should ask to be tested either by a neuropsychologist or any
Mm-hmm.
testing program to start. And it's not, you shouldn't be fearful of it. It's just a matter to understand. And then that way you can have that information. So later on, as you age, you can understand, oh, okay, what was I before? And you could see, is that a new change or is that the same?
Mm-hmm. I would love to do a podcast with you on cancer-related cognitive impairment. That would be a great
Yeah.
conversation, and where to go, how to get
Yeah.
assistance. I've talked with some speech language pathologists who are very involved with that, and they have a lot of great help with that. Michelle, is there anything else you would like to add?
Oh my gosh. I mean,
So much, but you can come back. There's
yeah,
not a
yeah.
problem with that.
No, I mean, I feel, I think one of my big messages for survivors, is again, create your supportive care plan from day
Yeah.
of diagnosis, knowing at every stage what can you do to be the most successful. If
Mm-hmm.
there's a way to prevent something, being proactive is the way to go.
Mm-hmm.
Use lifestyle medicine, such things as exercise, optimizing sleep, nutrition, and those aren't just like good things to do. We have data that improves outcomes for people who
Yes.
are on treatment. So it's like
Yes.
a magic pill. You get chemotherapy and then you get this other magic pill. It's called, lifestyle medicine. And then really understand that unlike a lot of other health related issues like an injury or something, things don't necessarily get better on their own, that
Mm-hmm.
you really have to have a plan and have experts guiding you. And
Mm-hmm.
so if you get through treatment and you have things that are not going well, um, then make sure that you have that plan and the expert that's helping
Mm-hmm.
you um, to get to where you want, to a better quality of
Right.
life.
Right. And I can see if your cancer institute does not have a survivorship program and there isn't one close to you, where you should have your own plan, your supportive care plan anyway. But creating it will let you, or a person like you were talking about on your crew, work to pull the resources in, the specialists in, to help you with those different symptoms by a little bit of research. And then the next step for that is contacting your insurance company and making sure you have coverage with that particular provider. Or if you don't, asking, okay, do you know somebody else that specializes in this, that's in network, that I can use, so that you don't end up with a financial burden through this. And
Absolutely.
right. And so I think that if you use a person on your crew to help you with your supportive care plan, from day one, that's an excellent idea. And it's going to change. It's going to be dynamic as you go through your journey. But that's great. I love that.
And I want to say one thing, which has kind of become a new theme that I've been thinking about a lot, is that we need
Hmm.
to tell people and have them understand you don't know what you don't know.
Right.
And this comes to the fact that a lot of times we ask survivors to like try to figure out what the problem is and find the resource for it. And I would say, if you don't have access to professionals, then yes, absolutely do that. But from my experience in seeing cancer survivors, it's very complex in unraveling
Hmm.
all of the issues, and a lot of times there's issues that are bundled together. So I'll give you an example. We see a lot of people who
Hmm.
have cognitive impairment, fatigue, sleep issues, and depression. Those are four
Hmm.
things that come together. Yet each person, what's driving that is different. One person, it might be sleep. One person, it
Hmm.
might actually be more from a psychological standpoint.
Hmm.
One person, it might actually be fatigue where they just need to start exercising. And
Hmm.
so if you can find a professional who really understands how to do this, you're going to get to your goal faster
Yeah.
because they're
Yes.
going to come up with a plan that's actually going to work. If you can't and you start on the journey, you'll probably get there. It'll just take you longer.
What do you think of an integrative oncology specialist for
So
that type of wellness?
I refer to integrative all the time. I use
Hmm.
acupuncture, massage, and everything. But you have to understand, integrative is like deals with all types of illness
Mm-hmm.
and wellness even. But so one of the questions is, are they experts in cancer? Meaning a lot of what I would do is I was the center hub because I had the
Mm-hmm.
highest level of knowledge how to
Mm-hmm.
treat cancer survivors. And then I pulled in integrative medicine when I felt like that was the right way to go. If
Mm-hmm.
you, the question is, if you're working with an integrative medicine group, are they as confident in doing that? Or is there another group in your
Mm-hmm.
hospital system that's actually focused specifically
On
on cancer?
cancer.
If
Right.
so, go to them first and then ask
Right.
them how to use integrative medicine.
Right. Right. I've worked with two integrative physicians who specialized in oncology, and they
That's the
were
best. Yeah.
phenomenal. They were absolutely phenomenal. And then
Right.
they did pull in the other resources as they
Right.
felt was appropriate for that person.
Yeah.
Um, this has been a great, great conversation, Michelle, and I can't wait to come back together again.
Good.
Hello. We hope you enjoyed this episode of the Everything Cancer podcast. We greatly appreciate you being part of the Everything Cancer community. The information on this podcast is not intended for use as medical advice. Please address your healthcare concerns with your healthcare team. The staff at the Everything Cancer podcast will not be answering individual healthcare questions. Again, thank you for being part of the Everything Cancer community. If you would like to support the Everything Cancer podcast, you may do so at Patreon/Everything Cancer. Also, you may support us on our website at Everything Cancer. Thank you so much and take care.